Hello, I'm Jennifer Spradlin from Ohio Christian University. This is my patient Drew Spradlin. He has previously consented. Today we're going to do a head-to-toe assessment, basically just explaining the assessment techniques, and then next week will be the actual head-to-toe assessment. I've washed my hands. I've introduced myself to the patient. I will start off by getting a patient history. Mr. Spradlin, do you have any medical history, hospitalization, sicknesses?
No.
Have you ever had any broken bones?
No.
Do you have any family history?
No.
So mom, dad, grandma, grandpa don't have heart problems, diabetes, hypertension. When's the last time that you had a doctor's appointment or a physical examination?
A year ago.
Okay. And are you up to date on all of your vaccinations?
Yes.
Okay. So I'm going to start off by basically examining Mr. Spradlin's hair. I'll look through the hair follicles. I'll also look at the edge of the ears, the skin, muscle tone. I'll do this all simultaneously. I'll look around the neck. I'll look down the arms. Muscle tone looks symmetrical. There's no issues with the hair. I'll examine fingernails around the cuticle areas. I'll look around to see, check a cap refill while we're doing that. I'll look at the legs, leg hairs, feet, toenails. I will then examine Mr. Spradlin's eyes. I will press around, actually do a little bit of a neurological assessment along with the optical assessment. I will then use equipment to look at the sclera and the iris, check the whites of the eyes, the eyelid, the eyelashes. I will then look at the nose. I will use a tool to look inside the nose, make sure that there's no swollen membranes, there's no issues with the sinuses. I'll feel around the sinuses. I'll then have him open his mouth. I'll look around the teeth, the color of the tongue, the texture, and look down the throat, also with the otoscope. The ears, I will assess around the ear. I will look at the inner ear with the otoscope, make sure there's no redness, no fluid, no bulging of the eardrum. Ear canal looks nice and clean. I will then use my stethoscope to listen to the patient. I will have him take off of his top, put him in a gown, and then I will take my hands to palpate both the chest and the back, make sure that muscles are symmetrical, make sure that there are no issues with unevenness. I will then listen to the lungs, having him breathe deeply as I listen in each lobe, front and back. Then I will also listen front and back so I can hear an audible S1 and S2 for heart function. I will inspect, can you sit up please, Mr. Spradlin? I will inspect the neck for any large jugular veins, carotids, anything that's like that. I will listen to his carotids with the stethoscope. I will then have him lay down. I will manually palpate the abdomen, filling in all four quadrants, making sure that there's no tenderness, that there's no issues with hard nodules or anything in the abdomen. I will then take my stethoscope and listen in all four quadrants to make sure that he has audible vowel sounds in each quadrant. If there's any tenderness with palpation, I will inspect that further. I will then ask him further, has there been any issues with urination, bowel movements? Have you ever had a problem not being able to urinate completely, pain with urinating, any type of issues with urinating while you sleep, anything like that, Mr. Spradlin?
No.
And you have very regular bowel movements?
Yes.
Okay. After examining that, then I will have him grasp my hands. I will finish the neuro assessment much like last week with the hand grasps. I will actually touch his extremities, all four, make sure that he can feel the sensations. I will have him smile. I will check his pupils for dilation and perla. Make sure that he's following the light. He has no nystagmus or anything like that. And we will also make sure that he has equal and strong grasps and push in the hands and the feet. After that assessment is done, I will ask him if he has any further questions. If he does, we can look into the assessment further. If anything during the physical assessment was abnormal, then we will also assess that further during the assessment. That is all for this week. Thank you.